Dr. Modern Mom asked how MCAS, EDS, and POTS are all related, and I can give you my take on this. It's simplified, and there's probably lots of reasons they're related that we don't know anything about, but I'm going to give it a shot. When a patient with EDS has connective tissue abnormalities, those connective tissue abnormalities stem from a disarray of collagen in the cells. So you can think of it as uncooked spaghetti. In a normal cell, the uncooked spaghetti in the box is upright and all in a row. But if you dump that spaghetti out onto the counter, you're gonna get a whole mishmash of spaghetti. That's what the collagen looks like in the cells of patients with EDS. That instability or disarray causes dysfunction of the cells. So these patients will have stretchier tissues, stretchier joint tissues, stretchier vascular tissue, stretchier connective tissue anywhere in the body. When the veins have this cellular matrix, they become stretchier, they're easily compressed, and they're more distensible. And when that happens, you get more blood pooling in your abdomen and pelvis and in your lower extremities. When the blood pools there, you have less blood returning to your brain. And when you have less blood to your brain, your brain tells your heart to beat faster. And that is a component of why patients with POTS develop tachycardia. There are many reasons, okay? For mast cell activation syndrome, when you have a cell that has a disarray of collagen, it's less stable. So these cells are more reactive. They can degranulate quicker or with less stimulation than the average mast cell. That's one theory about why patients with EDS have mast cell activation syndrome, and I'll link to that paper in the comments. So the connection between POTS, mast cell activation syndrome, and EDS is probably one of an underlying connective tissue problem, but they definitely are all interrelated. And when mast cells are unhappy, that creates a lot of POTS symptoms. So hope that helps. Thanks. Bye.